I'm Dr. Rachel Mandelbaum, a reproductive endocrinologist and infertility specialist at HRC Fertility. IVF is truly a miracle for so many families, but there are many stressors with the process, emotionally, physically, and mentally. It isn't lost on me that when patients leave my office, what they're seeing at home are the needles, the poking, and the prodding. So this is why I think it's so important that we keep pushing the envelope to make this process easier and more comfortable for patients. Getting rid of the injections with IVF is just the first step of the process. Needle-Free IVF is a brand new technology that I created to eliminate the need for frequent injection during ovarian stimulation for egg freezing or IVF. We use a small device that we place in the office on your abdomen through which all of the medications can go through, meaning no injections at home. I came up with the idea for needle-free IVF as a self-admitted needle phobe planning my own IVF cycle. At the time, I was working with pregnant patients who had type 1 diabetes and saw how happy they were when they got an insulin pump and didn't need to inject themselves all of the time with insulin. So I felt like there had to be an application for this technology with IVF. In my own cycle, I monitored my hormone levels, and I really felt that using needle-free IVF reduced my anxiety, particularly surrounding giving medications and self-injection. This then opened the door to a clinical trial where we took patients who were using the catheter and compared them to patients who were doing traditional needle injections. We monitored their hormone levels, checked their follicle growth on ultrasound, and found that patients did really well with the catheters. And even the ones who had done a cycle before using needle injections and then used the catheter stated that they preferred using the catheter. So now I routinely use needle-free IVF in my practice, and about 70% of my patients utilize this technology.